Hello to everyone. I am Dr. Vandana Hegde. I'm the Clinical Director and the Chief IVF Consultant at Hegde Fertility, a unit of Hegde Hospital at Hyderabad. Hi Ganesh, thank you for having me today. PCOS, an acronym for Polycystic Ovarian Syndrome, is the most common menstrual problem encountered in women. They could present with minor symptoms like hirsutism, which is excessive facial hair growth, obesity, thinning of hair, acne, or most importantly, the irregular periods. Now, this is mainly attributed to the irregular ovulation or the absent ovulation. This mainly happens because of the hormonal imbalance, which then gets exacerbated with a poor lifestyle. So, because of this irregular periods, they can either present with infertility or with heavy menstrual bleeding. And over long term, they do have a high insulin resistance, and this makes them predisposed to early onset diabetes, increased cholesterol, and leading on to hypertension and ischemic heart disease. PCOS has a polygenic inheritance pattern, so it cannot be totally prevented or cured, but we can definitely decrease its severity and control the disease. Complicated cases of PCOS can be prevented by adopting a healthy lifestyle, eating nutritious foods, exercising regularly, and managing a healthy weight. Lifestyle changes is the first line of treatment for the management of women with PCOS, but it is not an alternative to its pharmacological treatment. If you have a high insulin resistance, you may need insulin sensitizers. And if you have irregular periods, medication to regularize your cycles is very important, because you need to ensure that you menstruate every 45 to 60 days at least to ensure that your risk for endometrial cancer in future is reduced. The main pathology in PCOS is the hyperinsulinemia and insulin resistance. The hyperinsulinemia leads to increased androgens, which leads to facial hair, acne, anovulation, and irregular cycles. And the insulin resistance predisposes them to a metabolic disorder characterized by abnormal weight gain, diabetes, hyperlipidemia, and hypertension. So the cornerstone in combating PCOS is to decrease the insulin resistance, which is mainly done by optimizing the BMI. That is, by maintaining an adequate diet and exercise pattern. So they mainly need to increase their protein content and decrease their exposure to inflammatory foods like trans fats and dairy products. A nutritional counseling for PCOS patients has always been the treatment method for many years, and adopting a healthy lifestyle should be the first element for PCOS therapy. Focusing on overall well-being and mental health is a personal choice, and while it is not an immediate fix, it is an important step towards a more fulfilling life. They need to also maintain adequate exposure to sunlight with having a good sleep pattern and eating at the right time. You need to visit a doctor when you have missed periods or you are facing irregular periods, or sometimes you may have excessive hair growth, acne, and abnormal weight gain. So when you visit the doctor for the first time, a thorough history will be taken, and initially a pelvic scan will be done, preferably the transvaginal, where we get to see your uterus, your endometrial thickness, and even your ovaries to know if you really have a polycystic ovary. And then later a few hormone tests will be ordered, which covers not only your thyroid, prolactin, your basic blood sugars, your cholesterol, and the most important would be the hormones which we do on the cycle day 2, that is the menstrual day 2 of your periods, where your FSH, LH, testosterone, your insulin, DHS, etc. will be checked. And these will guide us regarding the severity of your PCO, and we can correlate these with your symptoms. Now, based on the symptoms, that is whether irregular periods or you're presenting mostly with hyperandrogenic symptoms like hirsutism and acne, the scan findings and your hormone reports will give us an idea regarding the severity of your PCO, and the further treatment will be planned. While infertility affects nearly 12% of couples worldwide, the ASRM, that is the American Society of Reproductive Medicine, estimates the rate of infertility to be between 70 to 80% among individuals with PCOS. PCOS is one of the most common but treatable causes of infertility in women. In women with PCOS, the hormonal imbalance interferes with the growth and release of eggs from the ovaries. This imbalance can lead to difficulties getting pregnant. So the first step in treatment is ovulation induction, which can be done with oral or injectable drugs. This promotes the follicle growth, which is then tracked regularly on scan, and ovulation time is identified so that the couple can time their intercourse accordingly. Majority of the PCOS patients conceive with this simple treatment within 3 to 6 months. If not, they do sometimes require advanced fertility treatments. congratulations to your radio channel for conducting this PCOS awareness, as its prevalence is increasing with increasing adoption of westernized diet, lifestyle, stress, and long working hours, etc. Firstly, my advice for PCOS patients is to get in touch with the reproductive medicine specialist at the earliest and get evaluated and diagnosed correctly. Then regularly follow up at least annually, even after completing your infertility treatment and completing your family. Because PCOS is a chronic metabolic disease and its repercussions are seen throughout one's lifetime, with diabetes, ischemic heart disease, and even complications like endometrial cancers. So as a preventive aspect and help ease the effects of PCOS, try to stay at a healthy weight, eat nutritious food and limit carbohydrates, and be physically active.